of Dermatology and the director of the Cutaneous Lymphoma program at the University of Pittsburgh Medical Center. And it's really lovely to have you with us tonight, Dr. Akilov. Thank you for joining us.
Thank you, Susan. Hi, everybody. Welcome. It's a lovely evening, and I'm very happy to talk about potion, lotion, everything that needs to be done to take being healthy and without a disease.
Great, thank you. And I know you have shared your wisdom on managing skin, particularly for folks with cutaneous lymphoma, where it's really important for us to be very consciously aware of taking good care of our skin, no matter what variation on the theme of cutaneous lymphoma we have, whether it's early stage mycosis fungoides or something maybe a little more challenging like Sézary syndrome. And I know it gets very confusing sometimes. I think even for myself as a patient, you go to the grocery store or to the local drugstore and there's a shelf full of all kinds of over-the-counter things, and it can be overwhelming and daunting to think about, well, which should I try? What's a good thing? What's the difference between the different products that are available? And I think sometimes as a woman, I'm used to taking care of my skin, I think sometimes, but sometimes the guys don't really know where to start either, and it can be overwhelming. So we're really thankful that you're with us. And I thought we'd start with maybe just an overview of skincare and lotions and what are the differences, and to give everybody a little bit of a baseline. And I know you've put some slides together as well to help us kind of learn. So I'm going to turn it over to you from here to kind of kick us off and get us started.
Absolutely, it's my pleasure. So Susan, you brought a lot of very important points. And what I'd like to, and what I usually tell my patients, that it's not important really to go for a particular brand or a particular type of cream. Certainly, it's not important to spend a lot of money. What's very important is regularly take a good care. So whatever you like, whatever you think works for you the best, stick with it. And just like a sunscreen that we tell you need to reapply it every 2 hours. The thing skincare, especially for diseases, your skin, especially for lymphoma skin, people need to use it frequently. And by frequently, I mean, we all know these people who carry a tiny little tube with them, and you need to be one of those people. Constantly carry cream and constantly apply on the skin whenever it's available, whenever you can do that. Let's look at a couple slides.
Okay.
So very important to know that skin is covered with a thin layer of oil, which acts as a protective agent and seals in water. So every single time when we wash our skin, we remove this thin layer of oil. And normal skin usually replenish
Dr. Akilov?
very easily. Yes, yes.
Can you put your microphone a little bit closer to your mouth so we can hear you a little bit better?
Sorry about that.
Great, thanks.
Can you hear me now? So it keeps falling
Yeah,
out.
that's better.
So what's important is to replenish this layer of oil regularly. And normal skin usually does it easily on its own. Disease skin does not do a good job. And this is where we need to help. Let's go on the next slide. And on the next slide, here you go. So very good pictures that show what happens to the skin in a little bit exaggerated way when skin starts losing a lot of water, when oil, tiny little layer of oil, disappears on the skin, and all this water just evaporates out of it. So we already intuitively know that we need to put tiny liter of oil to keep the water inside of it, right? So very dry skin, very crackled skin needs ointment, something greasy, something that does not contain a lot of water. It's not cream, it's not lotion. It should be ointment that would seal your own water inside of the skin. Okay, let's go on the next slide. So let's talk a little bit about soaps and shampoo. There's tons of different brands, and it can be sometimes confusing because a lot of companies that sell these products saying that it doesn't contain any perfumes, and patients bring it home, and it's not always the deal. So first of all, look at botanical products. So botanical does not mean that they don't have perfumes or any additions. It's actually quite opposite. They may contain a lot of different components that irritate the skin. So choosing the right soap, it's actually very critical. And again, it's critical because we need to be very gentle with whatever left out of this thin layer of oil on a skin that's already prone to be dry and itchy. So over here, you can see several different brands that work very well, like Cetaphil, Dove is very good. Free and Clear works pretty well. And surprisingly, Dove body wash, it's actually better than Dove bar. So let's chat a little bit about pH and why it's important and what to do about that. Yes, so here's the pH of the skin, and normal skin, healthy skin, has pH of 4.5, 5.0. That's mean pH balance. So you see it's not 7. 7, it's a neutral pH. So normal skin is slightly acidic. So this tiny acidic component prevents bacteria grow on the surface of the skin. This is very important. If we will look at what soap pH is, it's on the next slide. You can see that most of the soaps, look at that. So we soap the skin, right? And we put tiny little paper that changes the color. And from yellow, it went into the green category, right? So it's pH 8 or more, even close to 9. And you can see tiny little slips over here represent different soaps and different washes. And most of them also has pH very, very basic. So pH close to 9. So you can imagine that's putting this kind of abrasive soaps on a diseased skin that's already cannot maintain slightly acidic pH. It can be very damaging. So several products at the bottom, and you can see there's Cetaphil, Dove, and I believe Aquaphor. This is actually not a soap, but a beauty bars. So don't get confused. So beauty bars are not made for beauty. It's just a manufacturing term because it's a different process. So it's not quite a saponification. It's not how they make the soap. And soap usually made, it's a salt made by neutralizing lye and fatty acid. And beauty bar made differently. That's the reason why they're not called soap. So they need different term. And on the next slide, and we can skip this one. We talked about it. So let's go on the next one. Here you go. So this is the difference between soaps and beauty bars, right? So soaps have pH 9 and beauty bar have pH 5.5. So this is much more approachable for diseased skin. It's a much better choice for diseased skin. So we usually recommend our patients to switch from regular soap to something like this. And again, you know, brand is not important. If you love Dove, it's okay. If you like Cetaphil, you don't need to switch, you know, from Cetaphil to Dove. Use whatever works for you. Use whatever you used to have, and just stick with it and be consistent with application. Consistently use ointments that you like It doesn't matter again what kind of brand is it. It's much more important if you're using it 2 or 3 times a day, just restoring the balance of pH on your skin, restoring this tiny little oil layer that's necessary to restore the balance of normal skin and push all these bacteria and all this stuff out.
Very interesting. And just as an aside, we'll make sure folks can post their comments and their questions into the chat box, or if you want to give us a call, we can take you live via the phone. So the phone number's down here as well. So happy to do that. Just wanted to mention that. Didn't want to interrupt too much, Dr. Akilov. So we could keep going.
Okay.
Beauty bars and all the guys that are participating, it's okay to use a beauty bar versus soap, right?
Right.
Don't
So
be
it's
fooled
not
by
about beauty. Yes, don't be fooled. It's not about beauty, maybe a little bit, but it's more manufacturing stuff. They just cannot be called soap, so they came up with the idea to call it a bar.
Beauty bar, right? But if you like sort of having the physical, rather than a pump in like a gel or something like that, and have a cleansing bar, to do the beauty bars, don't do soap. The general,
that's true. Yes.
General.
So
feeling.
Some patients actually ask if it's okay to use soap for hair, right? So let's say somebody has this magical beauty bars that they just love and have a problem finding a good shampoo. So there is a trick about it. So for short hair, it's okay to use soaps. So when you soap your hair, soap actually does not dissolve completely. And it's a little bit hard to wash soap out of the hair because it's going in touch with keratin and protein. So on short hair, it's easy to wash it out. And sometimes, in a bath, if some people don't clean it quite well, there's this collection of gunk right on the bottom. So this is what's happening with soap in contact with human skin. But imagine this kind of stuff on long hair. So soap is not going to be washed, and all that stuff that we see on the bottom of the bathtub is going to be eventually on a long hair. So short hair can be washed with soap, but long hair cannot. You need to use a shampoo.
Okay. Well, and so if we are asking about shampoos, are there any recommendations from a shampoo perspective that you can share, kind of like the using body bars versus soap and things that don't contain that harsh or that alkaline, too much alkaline, right?
Absolutely. Yes.
Right.
So there's a lot of products for sensitive skin, and of course originally it was targeted for eczema and atopic dermatitis, but a patient with lymphoma goes through the same kind of process of struggling with skincare. So a lot of product made for eczema will work very, very well for lymphoma. At the same time, look carefully for product for psoriasis. That disease is different, and a lot of product for psoriasis actually target hyperkeratosis, which is thickening of the skin. This is not what's happening in lymphoma skin, at least not frequently. So I would say it's okay and safe to use product for eczema, and it's not okay to use product for psoriasis. Because, this is what's available over the counter. This is the most common skin diseases that's usually being targeted by commercials. Talking about shampoos, it's very important to look for sensitive skin. Interestingly enough, baby products very frequently does not have preservatives, does not have additional dyes, and do not contain perfumes. So One of the shampoos that we usually recommend is California Baby Shampoo for sensitive skin. Funny enough, it's look almost like a brown soap, so it looks very, very natural. But be careful with shampoos that look clear. So as you can imagine, I don't know how many of us try to make soap and shampoo at home, but natural stuff not always look nice and translucent and doesn't have color. Usually natural stuff look a little bit dirty. So when we're talking about something like free and clear, they use special ingredients to clarify this impurity, to make it more, marketing acceptable and more pleasing for people. So I would switch again to baby product for sensitive skin, rather than something like free and clear.
Very interesting. I would never have really thought about that. But okay, so we'll go for baby shampoo and it won't sting your eyes, right?
So this is actually also a very good point. So they add special chemical that wouldn't sting your eye.
Really?
So yes, yeah. So don't go for those products. It's okay. I think we're all adults, we can handle it.
Right.
Because
wow.
it's
okay.
a different indication, right? It's a different marketing tool. So for kids, because we will watch them anyway, frequently, right? The most important stuff is not to hurt the eyes. So you need some kind of numbing medication, some additional chemical to do that. It's not about unsensitive and clear and pure.
Very interesting. See, I always learn something. I did not realize that. I kept thinking, oh, it's safe and it doesn't sting your eyes, so it must be totally, perfectly pure without any chemicals.
Yes.
Ha, good to know. Really good to know. So that kind of gives us a baseline. So maybe you can share some general guidelines for patients. How should you moisturize? How should you take care of your skin on a daily basis? What, twice a day, 3 times a day, a lotion,
Absolutely.
a cream, an
Sure,
oil? What do
sure.
you do when you get out of the bath?
Yes.
Some recommendations
Yes.
for practical,
Yeah,
some practical
of
things.
course. So let's talk about creams and ointments. So there's a difference, right? So ointments usually much more greasy, right? They contain usually Vaseline and something more heavy. And creams, it's technically emulsion. It's an even proportion of water and oil. And oil base can be different. So for a lot of people, creams much more appealing because they don't leave this greasy feel on the skin, then absorb easily. But creams not always the best choice for diseased skin, because don't forget that creams are made for normal skin, skin that has intact barrier. And what we want to have with creams is just to add a little bit extra water and sometimes to get just a little bit extra feel into it. So some people, not some people, manufacturers add menthol to get this slight fresh feel after cream use. So skin that's compromised, skin that has patches of plaque, mycosis fungoides, or other type of lymphoma, is not normal, and the goals are totally different for that skincare. So again, epidermis is damaged. There's a lot of malignant lymphocytes in epidermis. There is sometimes tiny little cracks. It gets atrophic. So water disappears. There is not a proper oil control. So in some points, we need to go for ointments. We need to help skin to restore this barrier and particular localization. And again, that's getting worse during winter time more than summer, when we're all cranking the heat, there is not enough humidity, and diseased skin already suffers even more being in a dry environment. So in winter time, we usually go for ointment, something greasy.
Again, it doesn't need to be, plain Vaseline. There's a lot of elegant solutions right now, something like CeraVe that contains ceramides. It's a micromicelle that goes in between keratinocytes and hooks them back together. And at the same time, it has a lot of different compounds that restore barrier, that attract, it's called humectant. They attract water back into the skin. And at the same time, there is a small amount of stearine and Vaseline and cholesterol that restores the barrier, sealing ceramides and humectant that they add in the top layer of the skin. So in summertime, greasy products probably less necessary. And for the trunk, people can use creams and go for lotions or something like this. So my point is that different product made for different skin conditions. And based on what you have, you need to use different stuff. There is no universal product, and it doesn't need to be. So for some patients, I think it's important to buy product in small volumes. In dermatology office, very frequently we have samples. And again, brand is not important. What's important, your feel and your commitment to it. If you're actually going to use it, and you're going to use it frequently.
Got it. So in a normal day, someone should get up, and let's just assume that if they get up and they take a bath or a shower, does it make sense should you put a more oily base, or even an almond oil or something along those lines, and then let that dry and then moisturize on top if you have particularly dry skin?
Very good question.
Does a combination of that work?
So first of all, let's start with water, right?
Okay.
So shower should not be hot. It should be lukewarm, because lukewarm water does not melt the butter, right? So if people go after hot shower, all this tiny little oil layer will disappear. Plus, if they're going to use abrasive soaps that's pH 9, right? So it's all going to be gone. In this case, and again, this is our recommendation, people do different stuff. So let's say somebody went into hot shower. They cannot live without hot shower, so this is what they want to do. And it's a guy, so he's not going to get a beauty bar. So of course we're going for extreme, right? Hot shower, got abrasive soap. So he needs ointment. He needs thick ointment. He needs something like Aquaphor all over the body, right? And then, put clothes on. If a person listens our recommendations and go for lukewarm water shower, not very hot, not very long, using beauty bar, there's no need to go for thick ointment. It's okay to use something light, something with ceramide. Depending on season, again, summer we usually recommend lighter creams. Winter we can go for a little bit heavier creams. And I think we even have examples. Let me see if I can find a slide that we can show.
Okay. And we have a question that we'll get back to once you find the slide.
Let's show slide 21. 21. Yes. So you see there's a lot of ceramide containing product. And I would suggest that these products can be safely used daily for relatively normal skin that does not require additional help. And you can see I'm locked in over there, CeraVe, Aveeno. And again, this is what we were talking about, right? When you go into pharmacy and, so many products, what to choose? Go for something that has eczema word on it, not psoriasis, not something else, but go for eczema products that they most close to lymphoma. And you can see tiny little print somewhere and look for ceramides. This is the most advanced technology that we have. And usually feeling of these creams are very soft, very pleasing. It doesn't usually leave any grease that people don't like.
That's good. Okay, so we have a couple questions if you're okay with this. So, someone comments that you can buy CeraVe in bulk at Costco and Sam's Clubs with deep discounts. That's good to know, because we probably go through a lot of this, moisturizing on a daily basis. And we had another question with regards to using essential oils in skin management. I know the essential oils themselves, some of them, like there might be a lavender or a chamomile, which maybe is a little skin soothing. But from what I know about essential oils, you have to mix them in some sort of a carrier oil as well, or some sort of a base, not just the oil on the skin. I don't know if you have any thoughts or comments on that.
So essential oil, it's a little bit tricky. First of all, many oils contain a lot of irritating essence in it, and I would not recommend it for damaged skin. But at the same time, something like lavender, sage, chamomile has very nice anti-inflammatory property, and the main component of chamomile, bisabolol, actually one of the major components in Aquaphor. So saying that's absolutely not, don't use essential oil, it's a little bit, not being honest. But everything needs to be in moderation. So as you said, and I completely agree with you, I don't think it's okay to pour oil out of the bottle right on the skin, especially on the skin that has, patch or plaque MF. But adding a couple drops of chamomile into your favorite product, let's say in CeraVe or Ivina, I don't see anything dangerous about it. I think that should be okay. But again, skin should be relatively healthy. I wouldn't put it on ulcer. I wouldn't put it on open wound, but a little bit, maybe nice massage on the back. I don't think it's going to hurt anybody.
Good to know. And we have a call-in on our phone line, so we'll let our caller ask their question live. So go ahead, caller.
Hello?
Yes, we hear you. Hi.
Hi, I'm sorry.
Go ahead.
I'm calling because of my mom. 94 and a half years old, got her out of the nursing home, whatever they used to bathe her and do her shampoo. I found out they used everything for everything, So I got her home and her skin was sloughing off. I mean, sheets just coming off. She never had this before. And her scalp, she lost all her hair. The scalp was doing the same thing. So I started using this Ongaro Beauty products. I've never seen any change like this in her skin. I mean, it's got moisture to it. It's smooth. And basically, I mean, I used bacitracin zinc for the first couple of days when I didn't know what was open, and she was burning when she came home, and she was bleeding in her hands and everything. And these people thought nothing of it. They said, well, that's her condition. I said, no, it's not. So it's made some changes. Unfortunately, I'm without my laptop right now. I've got an iPad, of which I really don't know how to load things to, and I've got a cell phone that half works, sort of. But I got a couple pictures on the MF site, the MF page that I showed before and after. Now, it doesn't change the color of her skin. I haven't been able to get her the care she needs for this illness. She's 94 and a half. Not many people want to do many things but photopheresis, and I couldn't get her back to do photopheresis again yet. So she's been a good 8 months without any treatment. She's stage 4. How she's, I don't know, nutrition, I don't know what it is, but the skin products from these people, I've never seen anything like it. Can you tell me about these things? Because they're using probiotics. They're using aloe vera, which is organic. It says apple stem cells and tetrapeptide complex.
Mm-hmm. So I think
at
your
this
question
point,
has
I've
two
got
components.
the body butter that did the best. Yeah, I've got the body butter that did the best, and then I went to the body lotion. I've got this the body wash and the shampoo and the conditioner now for her. And it's like I don't want to say it's like putting Humpty Dumpty back together again, but these people, what they did to her skin, I've never seen anything like this. I don't know. They kept saying it was just her condition. I think it's what they used on her. Yeah. I mean, her hands were peeling and they were bleeding and her nails were coming off. And the nails maybe because they used her own clippers. And she may have gotten a fungus from them. So what can I do? I know. Thank you.
Sure. Thank you so much for your question. Now, very sorry to hear what you're going through. It's a difficult situation, but what can be done? First of all, if skin is very irritated and damaged and cracked and bleeds open, we should go even back further and not start with ointment and cream, and start with something different, something like cold compresses, because sometimes skins get irritated at that point where anything that would touch the skin would make the difference. So only cold compresses, and compresses is made very simple. It's just cheesecloths, made at least in 7 layers, and tap water put in refrigerators. Sometimes I suggest to do cold chamomile tea. That works very well, and we mentioned it before already today. And use these compresses just to calm the skin down. So when it's not that red, when it's not that angry, when it's not cracking and bleeding, then we can transition in towards ointment. And what's good with ointments, that it can be done as a wet rub. So again, it's not quite compress and it's not quite ointment. What you can do is to take bath, to put patient in a bathtub. But at this point, again, we talked about pH, right? So pH should be slightly acidic. So for this purpose, we can put tiny bit of white vinegar. And again, it's not a bottle. It's just half of cup per half of bath. So tiny bit, just 3 tablespoons, just to change the pH. Put the patient into the bathtub. It doesn't need to be soaked there for hours, just for 5 minutes, just to change the pH of the skin. And after that, very plain product without any additives, something like Vaseline, put all over the body, and put old pajamas. It would be nice to have them wet, actually, and put these wet pajamas. I know it sounds crazy, but it works. Put wet pajamas on a person and put another layer of pajamas on top of that wet layer. So it doesn't need to be completely wet, just damp, a little bit of damp. And patients need to sleep like this. That makes tremendous difference. So all that water from the bathtub, right, where we change the pH a little bit, is going to be locked down in the skin, and skin gonna stop suffering. So of course, one treatment is usually not enough. This is what this is a slide. It's called wet wraps. Usually you need to do it every day for a week or every other day. But it works. It's helped tremendously. And it's all about changing the pH, locking moisture in the skin, and restoring the tiny little oil barrier in the skin. But don't forget that cutaneous lymphoma doesn't stop with skincare. So still, it's a cancer. It's a cancer of lymphocytes, and treatment is important. Skincare does magical things and provides significant relief. We didn't even touch the pruritus yet, but a lot of people respond tremendously just to good skincare. And sounds like you're doing a good job helping.
Great. And thank you, caller, for sharing your experience and giving us the opportunity to talk a little bit about wet wraps and some other options for more compromised skin and some more challenging. And maybe that's a really great segue into what do we do about itch? What kinds of things can we do from, you know, a skincare to help manage the itch?
So itch pruritus is multifactorial. So several different mechanisms happens in a skin affected by cutaneous lymphoma. And sometimes good skincare actually may take a good care of itchiness. So why skin is itchy? It's a very old reflex. It's a very old signal that something is not going right. And what's not going right? The barrier is damaged. So we talked about restoration of the barrier. When ointment and creams over the counter is not helping, we can go and look for products that contain special medications. And usually there are several categories of these medications. Some of them numbs the tiny little nerves in the skin that send the signal of itch. And this is a medication with pramoxine. Again, CeraVe come out with new products. Sarna Sensitive has pramoxine over there. Sometimes it's enough to irritate different nervous endings. So there's tons of different nervous endings in the skin. Some of them sending itch signal, some of them, you know, responsible for touch, for feel, for temperature, for sensation of pressure. So something like menthol, right? Chemicals from the mint numbs different nerves, and that signals appear to be stronger. And it's kind of like because those nerves goes towards the one nerve. So if you irritate and send the signal from one, and you saying that's mental, make the skin tingling and numb and a little bit chill, sensation of pruritus may disappear just because one signal pushing another signal away. So that can work. Cold compresses, ice works very well. Don't forget, again, it's irritation of the nerves. So anything that can make it numb will work well. Some people develop itch in particular places only. So for those people, sometimes irritation in a different place in the body. Don't forget that itch can be so pronounced that people just, you know, scratch the whole skin with nails and we see the stretch marks. So for those people, sometimes products that contain capsaicin can be used, and capsaicin is a major component of the pepper. So let's say patient had an extremely severe itch in one place on the left thigh, but upper arm is completely clear. So we can put a little bit of capsaicin medication on the right upper arm, and we're gonna try to trigger the nervous system, saying like, listen, this is not where the problem is. Problem is actually on the right upper arm. And sometimes it works. Sometimes just it's enough to switch the signal to trigger the brain, and it doesn't itch in that place anymore. And place where you put in pepper spray eventually, you know, stop being irritated as well. So there's a lot of different tricks. Again, it depends what patients experience and what they're willing to go for.
Right. So we have a question that says, way before my diagnosis, I was prescribed Eletone, Eletone. Is that a good choice for moisturizing?
So again, you know, we talked a lot about brand names, and there's a lot of products out there. Some of them can be very expensive, and Eletone is non-steroidal moisturizing ointment, and it also comes in cream formulation. But I'm honestly against brand names, although we named a lot of brand names today. I don't think patients need to spend a lot of money on a product. It's again, even for beauty products, you know, and we're talking about facial creams, components not that important. What's important is the frequency of using. So if you get a tiny tube of very expensive medication and big jar of cheap stuff, but if you're going to use cheap stuff all the time and tiny product once a month, guess where you're going to see the difference.
Right. So consistency with a product is more important. Well, as long as it's the right kind of product that moisturizes the skin, right? So finding the right product, it doesn't matter that it's expensive, but that you will be able to use it often and always.
Right. Exactly.
Is a good rule of thumb, right? And I will just share, we've had some comments about you know, the quality of the discussion and so forth. And now we have a question. It's more about the effects of not maintaining my skin as well as I should. I use triamcinolone gel when I use something, but I often will go many days without applying it because I don't like the greasy feeling. So that's more a steroid medication versus a moisturizer. Maybe you can talk a little bit about the difference between, you know, even though it's a greasy formula.
Yeah, no, of course. So a lot of patients, this is actually a big problem because as a dermatologist, of course, we're going, you know, for a big jar of cheaper stuff and more available stuff and stuff that we know it's going to work quickly. But the person who asked question brought very good point that sometimes it takes time to find your product. And again, frequently in dermatology offices, we have a lot of samples. That's a good opportunity, and just ask a dermatologist, you know, be honest and say, I don't like greasy feel. I don't feel like I found my cream yet. Do you have any samples? Can you recommend something? And what I usually do, I grab whatever we have, and it's sometimes 10 and 15 different products, put it in a paper bag, and say, like, try it. Tell me what you like, and stick with it, right? So I don't like greasy products. A lot of people don't like greasy products. And when skin is normal, there is no need of using it. But find something that doesn't leave the grease, and it's usually creams, right? Some people feel even creams are heavy. And we're not gonna lie, you know, manufacturers sometimes go for cheaper stuff as well, and they start with fancy, right? And then they start adding more occlusive because it's less expensive, and it's going under the same brand. And you know, people swear they use it for years, and now it doesn't feel the same. Well, there is a reason for it. But again, you know, experiment, try and find what you like, stick with it, and use it constantly.
Okay, we have another comment actually that before this person's diagnosis, he itched to beat the band, which I think we can all appreciate, and his physician put him on hydroxine for the itch, and it really helped. So are there other things that folks can think about potentially to help manage the itch? Maybe in addition to you know, switching the nerve pathway or using a topical. Are there other options?
So hydroxyzine, other antihistamines usually work in some patients, not always, because what's happening in the skin, malignant lymphocytes, sometimes, well, they're malignant, right? So they don't function quite properly. Some of them start producing cytokines that nobody needs in the skin. And some of those cytokines, it's the tiny little peptides, with help of which other cells talk between each other. So some of those malignant cells start producing cytokines that's quite related to allergy, right? And they start bringing other cells like eosinophils. In those patients, and it's not always obvious, and you know, until you do the biopsy, you don't know what's going on there. For some patients, hydroxyzine certainly does work. And particularly, it also has a little bit of soporific effect. So help people to fall asleep easily and, maintain sleep well, because it's not a secret. When we go into bed, during the day we're busy, there's life, there's tons of other stuff happening. When you took your clothes, lay in bed, you start thinking, you start feeling, right? You start getting signals from your body, and it starts getting itchy. Stuff that you didn't notice during the day, during the evening time gets very noticeable. So small sedatives, valerian root, cup of milk, hydroxyzine, Benadryl, it does help sleeping. It numbs a little bit, again, this extreme perception from nerves. Sometimes even stronger sedatives are necessary, something like doxepin, and this is tricyclic antidepressant. That also helps a lot with pruritus. And even opioids, funny enough, we have one clinical trial that's right now active. This is how they actually found that it's working. Several elderly patients with chronic back pain were taking naltrexone, and it was found out, like frequently in medicine, accidentally, that it helps tremendously with pruritus, with sensation of itchiness. So one of the company decided that, giving patients opioids orally, probably a little bit too much. But what about putting it in a form of gel or cream and try it topically? So right now we have a clinical trial when we're trying to see if it's in fact, superior to placebo.
Interesting, right? So that's an open clinical trial, and we did an interview with Scott Phillips from the company, I think about a year or so ago, who talked a little bit about the clinical trial and the product, and folks can check that out on our website as well. But it is a very exciting and interesting clinical trial that we're tracking to see if it could potentially be something that can help with the very challenge of itch. We have another question here. If your skin is dry and cracked, how does that impact somebody with CTCL?
Well, dry, and yes, thank you for the slide. So dry and cracked skin certainly present a big problem, because cracked skin, first of all, it bleeds. If it doesn't bleed, it's really hard to clean, and this is the source for bacteria to enter the body. So infection can be a big issue and frequently very challenging in patients with cutaneous T-cell lymphoma, and certainly needs to be taken care of. So none of those cracks need to be ignored, right? And scales and rough skins need to be taken care of. It's a totally different series of products that's still available over the counter. And those products contain medication that helps to, so we talked about putting keratinocytes, tiny little cells on the surface of the skin together. Over here, we're doing a different job. We're trying to actually loosen them up and to get them away from each other. And you can see on this slide that we have salicylic acid, right, and urea. So this is two medications that's used most frequently for those purposes. But honestly, you don't need sometimes to go there. I believe I have a next slide over here when we can show that even salt, yes, salt baths. And again, this is without any additives, any perfumes. But that can do great help to treat thickened skin. Well, I would probably not recommend it for skin that has cracks because it's gonna hurt a lot. But skin that does not contain cracks, salt actually, you see, by osmosis, will go and push the water inside of the skin. At the same time, it's gonna loosen the skin a little bit on the surface, and skin's gonna peel nicer and faster. And of course, in combination with salicylic acid products, with urea products, that process can be done even faster, quicker.
Well, okay, so now the questions are coming in. What about CeraVe Renewing SA Cream? I don't.
So, well, it's quite specific question. You know, I'm not quite an expert about every single product. So let me just Google it quickly, what's inside. So we didn't talk about how to read labels.
Aha.
So
Good
you
point.
need always, yes. So by letters SA, I would assume it contains salicylic acid. Yes, and in fact it does. So salicylic acid, it's exactly the product that we just mentioned. But the same as urea, it's getting a little bit tricky, and you need to know the percentage of this product in percentage of salicylic acid in a cream or ointment. So high percentage actually peels much more significantly, when low percentage can attract the water by loosening the surface. So different percentage work differently. This is what I'm trying to say. So let's see what the percentage is over here. How much they put in it in this renewing cream. Well, they position this stuff for moisturizing for rough and bumpy skin. So that means that they're trying to achieve keratolysis. They're trying to achieve, you know, lysis of keratinocytes. So I assume it's at least 6 or 8%. I'm still looking how much they put
So
over
something
there.
that would be more useful in
for probably palms and soles.
Okay.
So there's interestingly enough, all these manufacturers, you know, come out with the same ideas at the same time. So we just had a Gold Bond come out with a series for palms and soles. It was yeah, and now CeraVe is trying to do the same stuff with salicylic acid. So it works. It works very well. But again, you know, don't be a stickler with a brand. You know, try to learn how to look deeper, right? So there's tons of different salicylic acid products. So you don't need to commit to a particular brand. If you know next to it, I don't know, CVS or some other pharmacy selling their own stuff with salicylic acid, you know, they always do, right? There is a brand and they're like, oh, here's our jar, 3 times cheaper. Don't go for shiny jar because it could be the same stuff cheaper. And they do it for the reason.
Right. So we just have a few minutes left in our time together. So I want to make sure if people have questions, we get them in. And we just have a comment here. It says, interesting about the free and clear. His regular dermatologist told him to use that. I think we probably all need to, yeah, right. We just have to all be a little bit more careful about labels and, right. Just like
usually what we do, you know, we give a list, you know, we're trying to avoid just one product. So I think at least give people a feeling that, you know, there's a choice over there, but a lot of products are very, very similar.
Right. So the more we know about what we're looking for, the better we can choose what works best for us in our individual circumstance. Obviously, it sounds like those things with urea and I won't say it right. Salicylic acid are better for the palms and soles with thicker skin. But if you have more patch, plaque, dry skin, you really want to do the ointments and the more moisturizing versus the kind of loosening of the thicker skin. Is that sort of a
Absolutely.
general rule of
Yeah.
thumb for folks. And I think, you know, as we wrap up here, oh gosh, let's see. Yes, CeraVe and Aquaphor would need to be applied every couple of hours to keep my skin normal looking. I feel like I've tried them all. Yeah, I think that's part of the challenge, right? There's no silver bullet. There's no magic product, to the best of our knowledge, that is going to work for everybody all the time, forever. And our skin may also change over the course of time, whether because of the disease or not. You know, it could just be the aging process, or where we live, the time of the year. So I think, at least from my perspective, for all of us to get to know our skin really better, and to read labels, and to be willing to experiment a little bit to find kind of that right mix that works for us. Any other, let's see, we've got another question. Heated wet wraps with steroid cream, bar none, gave me the best full itch relief for 24 to 48 hours. Lots of laundry, but a great option for big relief. Yeah. Seems to work
There you go.
well for some folks, right? Yeah.
Oh, absolutely. Absolutely.
Yeah. Yeah. And we're working on, you know, the good news is that there is, you know, the clinical trial for itch. And I think as we learn more about the other treatments that are coming into the clinical trial space, hopefully we'll find things that work a little bit faster for individuals that will also then help to manage the itch. So so we have just another minute. Let's see.
Susan,
the Vaseline and healing ointment come in big jars and are cheaper in the baby aisle and work just as well. So there you go. Some really great tips from our audience. Yeah.
And Susan, this is Mike jumping in. We did have a question that it's not showing up in the queue, but here it is. CBD oil. There's a question about that. What is that? Can you talk about that?
Is that cannabis? I have a feeling it's cannabis. Maybe.
Yes, you're right. So, well, you know, whatever works. You know, if people strongly feel that they need it, I'm not against it, honestly. I wouldn't put too much money into it. I don't think it's magical and cures the disease, but you know, if it's helped to provide a relief, why not?
Right.
And here's another question. Someone asked, I'm confused about what was said about opioids and pruritus, because naltrexone works for me, and that is an opioid blocker. Also, one paper about pruritus explained that some opioid receptors actually increase itch. Can you please clarify? It's complicated.
It is. So it's a blocker. So it's agonist, and agonist means it stimulates opioid receptors. But it's interesting. So there are several different type of opioids receptor. So it does work for people with addiction, but it's not quite a blocker of. It's actually stimulant. And we talked about that there's different receptors and different nerves participating in each. So stimulating one, you actually stopping the stimuli from each receptor. So it's kind of like counteracting. You're pushing signal from one, and that signal blocks another. Right now, again, you know, they're using this topical medication. So mechanism of it's going to be slightly different, and I don't think anybody knows exactly how it works, because what we know, everything comes from oral medication. And mechanism, again, oral and topical would be different in this category.
Right, right. And the clinical trial is for a topical naloxone. So that would be different from the
but publication actually came from from oral, so That's it.
Interesting. Okay. Interesting. So someone has said that their dermatologist gave them gabapentin for their itch, and it worked tremendously, and they are able to sleep. So that's another option, right? Right.
And again,
Right.
it's work for nerves.
Right, right. And someone said nighttime was the worst, which I think we understand a little bit why. When your brain gets quiet and you don't have too much to think of, the itch kind of rises to the surface. And their hydroxine helped to restore sleep. So I think, based on, and probably you in speaking and working with a lot of patients in a lot of different iterations of this disease, again, we don't have any silver bullets. So you have to try a variety of things and find what works. And someone's asking about, what do you recommend for pain? So pain versus itch.
So at one point, it's important to treat cancer. And I think it's a good end for our conversation, because in some clinical trials, when we use just skincare, effective skincare was 20%. 20% is a lot, but it's not 100. So at this point, it's important to address lymphoma as a cancer and try to get rid of it with medication that's, kill cells, so boost the immune system that will do the work. Because skincare is important, but at some point, we need to step back and look deeper. What's the cause of it? And cause of it is cancer, and we need to fight cancer.
Right, right. So, yeah, and again, looking for the big jars of Vaseline and the healing ointment, cheaper in the baby aisle. So, tips from our audience. Thank you so much. And so I think that wraps us up for this evening. Thank you, Dr. Akilov, for all that great information and for sharing all of your knowledge. And thanks to everybody for your great questions. And we hope that you were able to take away some very practical tips and thoughts and things about skincare and how important it is. And moisturize, moisturize, moisturize all the time, no matter what. Find your favorite thing and buy it as in bulk and as cheap, and use it. I think that's the best thing that we can all do. And then work with your physician to help you if you have more compromised skin or you have itch, things like, there are some options, and it might just be a little bit of trial and error, but give it a try.
And
so,
Susan, before we wrap it up, I think, I'm sorry, we had one more caller. I think we have one more caller that's been waiting on the line. So go ahead, caller.
Hello?
Go ahead. Hi, caller.
Turn down your computer, please, caller.
Is there
Go ahead.
any way of posting photos on this so that he can discuss what you looked at on the photos, or the before and after type of thing? When I called before, it was regarding this Angaro beauty product, this whole line. And what I'm trying to do is I want him to see the before and after, and if there's anything he can say, because I know other people are asking questions too about stuff like this, but she has done nothing else, and it seems to be improved. And I want to know why this stuff works so well, as opposed to some of the other stuff we provide. What ingredients in here that's doing this?
Certainly, we can look. Yes, post it, and we will look.
Yeah,
I don't know how to post it on here. That's my big problem.
Yeah, we probably can't post it on this live. You should probably try to post it on the Facebook page itself, not on the live. If you can spell it, we can try to look it up.
Okay, it's just ONGARO, beauty.
Oh, Angaro beauty. Okay. We'll do some research and then we can post. Go ahead.
Okay, I have the before picture. I have the after picture. It was only 3 weeks later, but I mean, I wrapped her feet and everything else. I was wrapping everything as the skin was sloughing off. I don't know why this worked. you know, but it helps. It's not the answer for curing her cancer. I know that, you know, but when you see
Sure.
she's 94 and a half years old and you see the difference in 3 weeks, and this is all I use.
Right. No, that's great. That's great.
Yeah.
So,
If there's a way I
OXG,
can send these photos, I mean, right. And Beauty,
you know,
Beauty.
Right.
They've got a website. It's new. It's a new product, and it's all organic. They don't have the other
Great.
stuff that's
So-
bad, and when you look at the ingredients.
Right. Great. Well, hopefully, folks, we can post that, and Mike, maybe you can, you know, we'll just post it here.
Where
and
do I
think
send
we've
the
got to
photos
let.
to?
Well, I think we can just.
Yeah,
send
we
them.
can
We'll
we
try
can have
to
the
take a
caller
look.
share it offline in like the Cesare group, and then we can get it to the Cutaneous
Mm-hmm.
Lymphoma Foundation. So thank you very much,
Yeah.
caller, and I think we're all set, Susan.
Okay, great. Thanks everybody again for participating, and thanks Dr. Akilov for joining us this evening.
very
I know it's a little bit late your time, so we really appreciate that. And we look forward to our upcoming shows over the summer in July and August. We're going to be talking about brentuximab vedotin and mogamulizumab, two products that are just recently either still in clinical trial or just coming out of clinical trial, to talk a little bit about those treatments. So stay tuned for that, and we'll have dates and more information as we get things confirmed. And with that, I will sign off and say good night. And thank you, Mike, for being our wonderful producer behind the scenes. We couldn't do it without you. And thank you, Dr. Akilov. Have a great evening, everyone, and have a great rest of your week. All right. Thanks, everybody. Have a good one.
Thank you. Good night.
Good night.